Hello everybody, my name is Margareta Ratih. I am a student from Polteka Mangunwijaya Semarang. Today, I will give my opinion about case study 17, informed consent. Taking into considerations that Mr. S was an extremely anxious patient, should the doctor have acted differently with respect to the explanations he gave to Mr. S? My answer is yes. Dr. D should have acted differently than he did. The doctor must be see the patient's condition is very anxious and calm his patients with good communications. The doctors must also be a person who trusted to do competent actions. The doctor must be explains the objective, procedure, side of effect, and risks of the actions to be taken as a standard operational procedure that must be done before the patients agree. A consent will be valid if it has been given in respect of the proposed treatment. The autonomy of the physician is to strictly adhere to the rules of informed consent. As part of the autonomy and respect, he is obligated to his patients. Therefore, the physicians must always consider the personal characteristic of the patients, such as anxiety, his special particularities, asthma, such axis, and his unique personality, and relate to it by providing the relevant explanations. One of the challenges facing the medical staff is providing its patients with appropriate information. Every medical treatment requires the patient informed consent. The significance of this consent is that a persons agree to the treatments, the invasions of his body, understand the significance of his medical conditions and the meaning of the treatment, the dangers and the benefit inherent in the treatment, and grant his informed consent willingly and without concessions, as determined in Articles 6.1 of the Universal Declarations on Bioethics and Human Rights. Clear information about the actions to be taken help the patients reach informed decision freely regarding the care to be given. The patient has the right to know all relevant information before he agreed to it. The anxious patient's conditions should allow the doctor to start effective communications to make the patients calm by inviting the patients to demonstrate what the patients must do when the procedure is done. The procedure must be well explained given the side effect of the dangerous actions, so the patients understand what he must do. Patients' preparations need to be done before taking actions. Patients are trained to hold their breath and refrain from moving. Patient's preparation is very important. In the medical examinations, must pay attention to analytic, and post-analytic stages. One of the pre-analytic stages is preparations of the patient. I share my experience when I was doing job work or PKL in the ones of the hospital in Semarang. I faced patients who were anxious when the action will be taken, and my practice counselor at the hospitals always remind me, a medical laboratory technologist must be able to deal with all patients' conditions. Medical personnel must be confident in your competence. Don't make the patients doubt. We must seek approval and submit incorrect information before taking an actions. We honestly say that the injections cause a little pains. Instead of operational procedure, we require to provide correct information and must not to lie our patients. I always invite patient communication to reduce the patient anxiety. I always say that the injection, like being bitten by ants, it is not dangerous. Little pain to recovery. Give words encouragements to the patients to make him calm. Okay, guys, this is my opinion about case study 17, informed consent. Thank you for watching this video. Stay healthy, stay safe, and God bless you. See you again.